We're talking with Dr. Ira Byock, director of the Palliative Care Program at Dartmouth-Hitchcock, about the concept of dying well.
I got into this work really through my interest and career path of family medicine. Years ago, when I was in medical school and even in my residency, I thought I was going to be a rural family practitioner. I wanted to move to a small town in the Rockies and practice in, either solo practice or with one or two family practice colleagues. So my training was in a lot of quite intensive medicine. I learned intensive care and even neonatal care, and I learned how to do my own C-sections and fracture management and all of that. As I went through training, and I was getting involved in hospice care, which was the early model, if you will, for all of palliative care. And remarkably, I saw that it wasn't done well in the hospital that I was training in. Even though we were a darn good hospital, we didn't do this very well. People were falling through the cracks. People were not getting their pain medicines refilled on time. People were, had bowel problems that could have been easily prevented, and it were making them miserable unnecessarily. But I also found that, to my surprise, that in caring for people who were facing the end of life, it was really important to them and was deeply professionally satisfying to me. And it felt, this may seem odd, but it felt much like the satisfaction that I was also feeling in caring for pregnant women and delivering babies. Less joyous and less celebratory in that sense, but equally important, profoundly important, within the life of the individual and the life of the family. My approach to family medicine had always been based on the concept of human development, this sort of life cycle of human development. And much of my writing has been about applying that normal model of human development to this last phase of life, trying not to pathologize or assume that people are depressed or have psychiatric level anxiety or adjustment disorders as they're facing the end of life. No, it's enough to just look at the end of life in the realm of normal human development, where there are developmental crises that we face, and we grow through those crises. And so I've, for years, made an academic career now of sort of thieving from the pediatric developmentalists, the Maslow and Piaget and Erickson, and taking that basic human development model and bringing it to the end of life. And it turns out you can respond to people, even people who are suffering, without assuming that they're pathologic in some way. They're just human beings going through, frankly, a natural disaster that awaits us all.
And so where there's a lot of attention paid to natural childbirth or having that be a natural experience, that it feels like in our culture we have trouble acknowledging that this is a natural process as well.
We have a lot of trouble acknowledging that the end of life can be natural. And in fact, within this disease treatment system that has become the dominant sort of approach of American medicine, we always assume that there's a fix. That, well, if they can't fix it here, we'll just go to the next big town, or we're going to go see the super specialist. And we have been taught to fight against injuries and illness, which, in all honesty, works most of the time. But because we're mortal, at some point, it's not going to work. And we have to also expand our professional frameworks, those of us who are clinicians, but also for all of us, we have to expand our sort of cultural view of how normal, healthy life continues and finally closes, to accept the fact and incorporate the fact that this time we call dying, as hard and as unwanted as it is also normal and actually can be a healthy time in the life of the individual and family. And I know that sounds odd, but that's my experience. People, I often talk about people can die well. That phrase, dying well, most people, when they hear that, hear the word well as an adverb, right? People, oh, they're doing it right, or they're doing it just the way they should, or, isn't that wonderful? But I actually think it's more provocative to hear the word well as an adjective describing the person who is dying. Can you be well within yourself, emotionally, spiritually, right with the world, even during this time of life when you're dying? If you think about it, of course you can. I mean, people don't have to be depressed or unwell as a person just because their body is at its natural conclusion. And, so many of the stories that I talk about and the books that I've filled stories of real people that I've written are about people who in some way have taught me a bit about this notion of well-being during the last stages of life. I write that and I talk about this stuff because I think it is something that this culture needs to understand. As a culture, those of us in America, certainly my contemporaries, we baby boomers, we need to grow the rest of the way up. We need to acknowledge that we're mortal, we're gonna die, and get over it. And get on with really looking at what does a healthy human life look like during this normal developmental stage of life? What's it look like for all of us as individuals, but also what's it look like for our families? How can we best serve our family, those of us who are fathers and mothers, grandparents? How can we best serve our family during this final stages of our lives? We're not talking about that in this culture, and we really need to be. It's time.
What are some of the things that those people have taught you?
People who are facing the end of life have taught me that the most important things in life aren't things at all. They're other people. And I have learned from that, and I often will counsel people that I see as patients and ask them gently, what would be left undone if, heaven forbid, you were to die suddenly today, as any of us might? I don't mean just your business affairs or your, or your legal affairs, but how about your personal relationships with the people who matter most to you in life? Your children, your brothers and sisters, your parents, others. What would be left unsaid? Most of us have relationships that are not perfect, right? If I've learned anything, by the way, in life, is that human beings are imperfect. My best advice for that is get over it. You're just human. That's good enough. Have some mercy with yourselves, but also have mercy with others. And so because we're not perfect, our relationships tend to be imperfect. Usually, even in the most close and loving relationship, there will be some history of hurt feelings or misunderstandings and sometimes real transgressions. And so part of what I've learned is that it's useful in facing the end of life to make sure our relationships are as well as they can be. Not for some rule or guideline, but because people tell me it matters to them. For years I've been teaching people that, and people have taught me, so I just pass it along to others, that there's often value in saying at least 4 things to one another before one or the other of you leaves this life. Please forgive me, I forgive you, because there hasn't been a perfect relationship in the history of humankind. Please forgive me, I forgive you, thank you, and I love you. Those 4 things allow one to be much better prepared to say goodbye to one another when we're forced to say goodbye to the people who matter to us.
And have you seen specific instances where people saying those things made a difference in them feeling prepared to die?
The fact is, it almost always makes a difference in people feeling better about this situation that nobody wants. This sense at least things aren't undone, aren't unsaid. And so often when people have been distanced by transgressions or hurt feelings or anger between them, when one or the other is forced to face the fact that time is short, not uncommonly, the things that separate us begin to look small in proportion to the bonds that connect us. Father and son who fought over the years, a father who'd been a heavy drinker and abusive to his wife and family over the years, in being able to say, please forgive me, I forgive you, thank you and I love you, not uncommonly, warmth happens. A sense of forgiveness begins to permeate the relationship. And people die. I mean, the most common response that I get from people after they've actually said these words are, why didn't I do this earlier? So what I begin to teach people is, you don't have to be dying for these words to matter. You really just have to be mortal. And if you're not mortal, if you're going to live forever, if you love someone who's mortal, well, that's actually enough to make those words valuable.
So we've talked about a couple things in terms of dying well. Talked about the importance of a comfortable situation that feels like home if it's not actually at home. Having your family, having your friends there, getting things right with people so that they feel a sense of peace and the person who is dying also feels a sense of peace. Are there other elements of dying well that you feel are common?
I think in addition to saying the things that would be left unsaid and having a sense of completion in a relationship, I don't mean that the relationship ends, but that they're complete like a circle is complete, like it's unbroken. So keeping your relationships complete allows one to then celebrate those relationships, to celebrate the life that you've shared and the relationship that matters to both. I would only add that beyond that, the thing that most matters to people often is leaving a legacy. And frankly, it's what most matters to families often, that they come to acknowledge the often bitter truth that they're going to lose their mother or father who they love so dearly. What's left is, can we celebrate this person, honor and celebrate the person we love in their passing, and can we develop some sort of legacy? My favorite way to develop a legacy is, frankly, to allow people to tell their stories. Just the stories of where they grew up and, you know, their experience in school, the first jobs they've had. I often will ask people if a tape is running, think back to when you were 10 or 12 years old and you were in school or you were working on the farm or whatever it is. Did you ever get in trouble? Boy, the great stories come out. Mostly that their children may have heard once or twice, their grandchildren have never heard, and their great-grandchildren will revel in. Those sorts of stories, the mundane stuff, how'd you meet your spouse? You know, what were you doing during the war, whatever war fits to their age and, time of life. What do you like to do? Whatever you like to do when you weren't working. All of that stuff is just great grist for the mill and really creates a legacy that I believe is more valuable than all the, jewelry or the real estate that you can possibly pass down to a family.
I mean, this really feels like it's turning this on its head a bit, where people would think, boy, the time that my mother died was the worst experience of my life. You know, she was in the hospital. I don't ever want to talk about that experience again because it was completely catastrophic for the family. And that there's this opportunity to actually, and again, it sounds like some planning needs to go into it and certain things might need to align correctly, but there's an opportunity where this becomes, if not joyful, it becomes something that people can carry with them as a positive thing.
I think that's absolutely correct. That these are inherently difficult times, and having a mother or father die in an ICU, perhaps after protracted treatments, that there's been this hope that they were going to get better, but they haven't gotten better, and ultimately you realize that they are dying, and then they do die. It may be tragic and horrible, and at the same time, there may be actually precious opportunities and value there, concomitant with the tragedy. Our job is to make sure that the care is as good as it can be, that the person is comfortable, clean, and that the family has a chance to, in the midst of this unwanted, tragic experience, to honor and celebrate the person, to tell stories about them. You know, the Irish have this notion of the Irish wake, of which is really the celebration. Well, in a sense, we can wake people out of life if we have a chance to do so, and if the family has interest. We can celebrate them, not in a celebrate like confetti and party hats, but this solemnity interfused with celebration. In a sense, I think that is really a healthy, almost defiant response to mortality, to the fact that we're going to lose the people we love so much. In a sense, we're saying to mortality, we matter to each other, that even death can't take this from us. And we are going to honor and celebrate our mother or father or grandparent out of this life. It is a healthy human response to a lousy human experience. And again, that's part of healthcare. That's the continuum of healthcare that we're trying to model and provide an example of right here in the Upper Valley.
This Healthy Highlight is brought to you by Dartmouth-Hitchcock and Ledyard National Bank, working together with our community partners to improve your well-being.